Hello, everyone, and welcome back to my channel. Today, we're diving into a topic that's both vital and potentially life-saving: myocardial infarction, commonly known as a heart attack. We'll discuss the causes, symptoms, prevention, and what to do if you or someone else experiences a heart attack. Let's begin by understanding what a myocardial infarction, or heart attack, actually is. Definition: a heart attack occurs when the blood flow to a part of the heart muscle is blocked, usually due to a blood clot. This leads to damage or death of the heart muscle. Causes: the primary cause of a heart attack is the buildup of plaque in the coronary arteries, a condition called atherosclerosis. Risk factors: there are several risk factors for heart attacks, including high blood pressure, high cholesterol, smoking, obesity, diabetes, and a family history of heart disease. Recognizing heart attack symptoms. Knowing the symptoms of a heart attack is crucial, as early recognition can save lives. Common symptoms. Common symptoms include severe chest pain or discomfort, shortness of breath, profuse sweating, and pain radiating down the arm or jaw. Differences in symptoms. It's important to note that symptoms can vary between men and women, and some may experience less typical symptoms, like nausea, dizziness, or fatigue. What to do during a heart attack. In the event of a heart attack, immediate action is vital. Call ambulance or rescue 1122. The first step is to call ambulance, rescue 1122 or your local emergency number. Do not delay. Chew aspirin. Chew one regular-strength aspirin while waiting for the paramedics, as it can help prevent blood clots. Cardiopulmonary resuscitation. Start cardiopulmonary resuscitation CPR. If the person becomes unresponsive. Preventing heart attacks. Prevention is always better than cure. Healthy lifestyle. Maintain a healthy lifestyle by staying active, eating a balanced diet, quitting smoking, and managing stress. Regular check UPS. Regular checkups with your healthcare provider are essential, as they can monitor and manage risk factors. Medication. In some cases, your doctor may prescribe medications to control blood pressure, cholesterol, or blood sugar. Conclusion. In conclusion, understanding heart attacks, recognizing their symptoms, and knowing what to do during an emergency can make a life-saving difference. Remember to take preventive measures and spread this knowledge to protect yourself and your loved ones. If you found this information valuable, please give this video a thumbs up, share it with others, and don't forget to subscribe my channel for more health and wellness content. Thank you for joining us today. Stay heart healthy, and we'll see you in the next video.